So, welcome to 2022. This is our first session of the year, and we had a few little technical hitches, one of which was Dr. Bill seemed to have renamed himself Sue Moore. Sorry about that, Sue. Not sure how that happened or what happened there, but he's finally arrived with this, which is fantastic. But that means that Bill and I haven't had our normal 10 minutes to kind of be as one mind. So we're just going to hit the ground running, if that's okay with you, Bill. Seeing everybody's come to join us. We were very confused, but we've had the lovely Andrew McKee with us, who you'll meet in more detail next week because he's one of our panel members. And he's someone that Bill knows as well. So Andrew's been a great source of calm support. So that's encouraging for this topic.
Is that Canadian? Is that Canadian influence?
Oh, it must be. Yes,
yeah,
it must be that laid back Canadian. So look, welcome everyone. And we're delighted to have this third masterclass on neurodiversity. And we're delighted again to have Dr. Bill Pettit here amongst us, with us, really speaking tonight to what he's seen about this diagnosis and really a kind of technical brain-based understanding of it, but very much looking in the direction of where does hope lie? And how does an understanding, a spiritual understanding of the mind or of mind, impact and support when we have a diagnosis like this? So where does peace of mind lie? Where does hope lie? And how is it that we can access the gifts of whatever brain processor God gave us? So today, it's very much a kind of presentation, and some of you may have received some notes that Bill very generously has prepared for us. There'll be some more to follow with some of the technical bits, which I'm sure Bill will talk us through. So, you know, one of the pieces of today is very much a brain-based understanding the brain and the brain processor, and what is it that we know about different processes. So that's a part of tonight, but also we'll be looking at what are some of the gifts of this particular kind of brain processor. What is it that people can do effortlessly, and what's available to them in terms of assets? And yeah, what challenges are also there too from time to time, but how can we understand more about this as a natural part of our human family, that people are different? So I just really want to recap on where Bill and I are standing when we're talking about neurodiversity, just very briefly, which is a sort of passion subject of mine, which, you know, when I did the original Real Change Live with Dr. Bill, like any good medical student, I had absolutely everything at the end of each episode. You know, so we talk about depression and I go, oh yeah, that's me. And then we talk about you know, anxiety, and I'll be like, oh, I have that sometimes. So, you know, it's kind of pretty normal when you're really engaged in a subject to apply it to yourself. But then when Bill started we talked a little bit on the first round in 3 years ago about ADHD. And we often would chat, Bill and I, at the end of the calls. And I remember, you know, saying, I think my brain is on speed. And I see my friend Nick Bird there, because Nick Bird and I share a fast brain. I mean, not the same brain. Sometimes it feels like the same brain, but we both share a very fast brain. And I really could see that the brain processor speed of my brain was a gift and a curse. And I really, and a curse when it ran away with me, when I didn't have an understanding. So you know, really excited tonight to present, go deeper on this one. And then next week, we'll hear some stories of real hope, and we'll also really answer your questions. So maybe there's no time for questions today, but we will come around to that, and you can ask your questions in the week to Bill. But where I stand on it and where Bill stands on it, and I just did a little kind of ADD jump there. So I'm just coming back again to the point, which is all is welcome. So neurodiversity looks the same to me as any kind of diversity. And for those of you that didn't hear me introduce this on the autism set webinars, It's as simple as this in my mind. We know that diversity is good in the forest, in the ecosystem, in the whole, and that monoculture, not so much. We know that we need difference. The differences helps us make better decisions when we have different perspectives. We know that that diversity creates something that can't just be achieved when we all work the same way. So why would a brain processor that works a little different not be perfect for the whole? Different with its unique assets and liabilities, like everything. You know, if you're short, you might be better at tumbling than you are at playing basketball. It's a physical thing, you know, and that doesn't have to limit you. But there's natural assets that we have physically, and there's natural assets that our brains have. So we'll understand that part. But then if I know Bill, he'll take us to a deeper seeing, what's kind of before that, that's also our inherent true nature, and how understanding more about that can help us with any diagnosis that we may receive. And that when we come home to ourselves, we're more in touch with our essence. So that's really where we're coming from. This section is really going to be handed over to Bill very shortly. And it is, for those of you who haven't come across Dr. Bill, he's a board certified psychiatrist. He's kind of in retirement, although to be honest, he doesn't really seem that way to me, just kind of a story that he says often, but he's very active. He's often running programs. In fact, one starts tomorrow. Just going to give him a little plug. You know, there's one that you can jump in last minute. You know, they're very loving programs, and Bill is Thriving Together, it's called, so you can find out more about that. But he's really seen it all when it comes to psychiatric disorders. He's worked in so many settings. He's worked with thousands and thousands of people, and really nearly coming out for 50 years, if it isn't already, Bill. I'm sorry to out you on your age, but you know, you've been at it a while. And I'd say that probably the last approximately 30 years, he's had an understanding himself that when he shares what he's seen with his patients and the people that care about them, there seems to be an extraordinary impact on their sense of well-being, peace of mind, and hope. So that's what he's going to be speaking to. He's going to be speaking to the technical side of this particular diagnosis, and he's also going to be talking to what he's seen about where hope lies. So I kind of done enough talking for a little while, and I think it's definitely time. I mean, you know, to know Dr. Bill is to love Dr. Bill, but he's very generously giving of his time and his energy to help us all see something new and fresh about this subject and point us back home. So without further ado, thank you, Bill, and over to you.
Thank you. Thank you. So we have 75 minutes total, am I correct? So we still have a little over an hour, and you know, let's see if we might have some time for some questions. You know, we'll see. I forwarded a set of slides, you know, just so people wouldn't feel that they needed to write anything down, but also so that you know, when you're just listening to somebody and listing different things and then referring to them, sometimes it's nice to have a visual reference. So were you able to send it to the people that had registered? Yeah. And then
Yep.
I'm sure people know I only recently learned how to print off like 6 on a page, you know, so I didn't have to have 40 pages for 40 slides. So, you know, they're trying to train an old dog new tricks here slowly. You know, and it all boils down. This note to the reader, as I've quoted before from The Enlightened Gardener Revisited, the author endeavors to explain in his own unique way the connection between our spiritual nature and our psychological nature, and I would say, and our physical nature. And the mind is spiritual, the brain is a computer. We're not our brain. We're not our brain. We have a brain. To the degree that we truly don't just understand that cognitively, but realize that there is no output from our brain that can frighten us. None. Or overwhelm us. And we have no need to be in combat with our brain or struggle with it. The struggle is what, if you will, to use a metaphor, the brain loves, because then it just ramps it up a little bit and goes a little faster. And we have the experience of being overwhelmed by our brain, but or being overwhelmed by our lack of understanding. And it's innocent. It's innocent. And it's incremental. Remember, please remember this understanding that we'll call factor U, the understanding of these three universal principles. Remember what that Sid said, there's an infinite number of doors of understanding. That's a really big number, I think. It's important for us to remember that so we don't get into judgment of ourselves of, I've been around this for this many years and I still don't get it. There's no it. There's just a direction of starting to see, as my friend Andrew McKee will talk about, that he really saw, and he teaches people, what if you would be, what are you if you're not your thoughts? To me, that's another way of saying, what are you if you're not the output of your computer? To the degree that people don't understand that or forget it, some people have a much more sensitive alarm system that they're taking their brain too seriously. Some people have a much more sensitive alarm system that they're taking their output of their brain too seriously. And what we do is we put labels on things like that when they're different, as Elizabeth said. We try to put things in boxes. I was never diagnosed with attention deficit disorder, and I don't think I really meet criteria, but I will tell you that I'm probably about 3 inches on the spectrum, 2 inches from there, to where I always procrastinated. I waited till in college and school and wherever, I waited till people said, there's no way you're going to be able to pass that test. You haven't studied for 3 weeks. I'd say, oh, okay. That's all I needed to hear. Watch me. And then I'd do what I needed to do, which is often something that people with ADHD do too. They put it off, procrastinate, because it wasn't easy at the level of understanding that I was at to focus. So I had to hyper focus. I had to get to where I had no choice, or the choice was such. So let me go through the diagnostic criteria. And as I go through these, especially the ones on inattention, just as an overview, the diagnosis has changed through the years. I am retired from being clinical psychiatry. I mean, I don't practice clinical psychiatry. I don't write prescriptions. I don't, but I certainly have the knowledge, and I still keep up with, as I'll hopefully have time to share with you a couple of recent research articles on ADHD seen from the perspective of the understanding of the three principles. But especially when we go to this inattention one, and to some degree the hyperactivity impulsivity, I'm going to ask all of us to look at the time, even if you've never had this diagnosis, if when you have gotten yourself stressed out by your thinking, that if you haven't met criteria, Now, to have the diagnosis, you have to have it maintained for at least 6 months, right? So here's the ADHD criteria, and there's two groups. There's the inattention criteria. Oh, you don't need to know show the slides, Elizabeth. If people have, I'd rather just talk to people. Is that
Perfect.
okay? Yeah.
Yeah, no, just wanted to help. Fine.
No, that's fine. No, I'd rather, if it's okay, I'd just rather talk to people, and you'll have them. I just want you to know that you'll have them, so you don't have any anxiety about them. So there's going to be 9 criteria for inattention, and then there's 9 criteria for hyperactivity and impulsivity. And the latest iteration of, there's 3 diagnoses related to ADHD. One is if you're predominantly inattentive, if you have 6 of these 9 present, only if you get to age 17, 5 of the 9, then that would be positive for inattentive. And then on the hyperactive impulsive, the same thing, there's 9 criteria. If you have 6, if you're less than 17, or 5 if you're 17 or older, then you meet criteria for hyperactivity impulsivity. If you meet criteria for both of them, then you're combined, ADHD combined, hyperactivity and inattention. Most people who meet one of those have at least 3 or 4 of the others positive. It's usually not 9-0 on the other one. So let's go through them. So inattention, difficulties with paying close attention, and I'm going to give the short version. If anybody wants to, they can always Google DSM-5 and get the full long 4 sentences. Inattention, difficulties with paying close attention to details. So people that have difficulty with that, they make careless mistakes, whether at work or in school, things they know, but because their inattention is such that they have trouble paying close attention to details, have trouble sustaining attention, can keep attention for a period of time, but then I raised 2 children and 2 adopted children who had ADHD. And the incidence, by the way, as you'll see later, among the general population is about 5%. Among children that are adopted, it's almost 33, it's almost 1/3. We'll entertain what's up with that, right? My daughter used to say, I try to, but my mind would go off. I'd pull it back. My mind would go off when she's learning fractions in 5th grade or 4th grade or whatever it was. And then she'd pull, and she had a teacher in math that was not, he should have retired a long time ago if he ever got in the right profession, because he would then stand over her and say, Maggie, want to tell us the five steps with fractions? And she remembered 1, 2, and 5, but 3 and 4, she was gone somewhere. And she would come home sobbing and crying. Do I have to go to school? Please don't make me go. I remember her sobbing to my late wife, Sue, Mommy, please don't make me go to school. I hate it. I hate it. I hate it. It's hard to be someplace that's not supporting you and where you are. Difficulties with listening, number 3. If your mind is going here, there, and everywhere, bouncing around, it's hard to be present. It's hard to listen. Following through with instructions. Oftentimes I would tell people that I'd say, if your mother told you to, especially if there was more than one thing, to go out and get the mail, to take the garbage bin out from the garage out to the sidewalk so it can be picked up today. And while you're there, bring the mail in from the mailbox. I would see people say, I'd probably get one of those done, but very unlikely that I'd be remembered to do both of them. Organizing tasks. Typically the child's room is and their closet is just, it's not real pretty. And I look sometimes, my office is the best it's probably been in 2 years, but I look sometimes and I go, organizing things. So sustaining mental effort for a long period of time, sustaining mental effort, losing things. Sustaining mental effort, people talk about sitting down to do homework, up, down, go get this, up, down, sustaining mental effort, losing things. I know one assignment, I remember one of my daughters, she did it 8 times. We found later behind the radiator in a closet. She wasn't hiding them. She just would forget where she put them. Being easily distracted. The slightest thing can pull the attention away. The slightest thing. Being forgetful. So I ask if any of us, is there any of us that hasn't been in a state of stress with getting caught up in our thinking where we didn't have trouble paying close attention to details, sustaining attention, listening, following through, organizing, sustaining mental effort, losing things, being distracted and forgetful? I would bet that there's not one person on this talk that hasn't had that experience. Hyperactivity, impulsivity. This is something that's a little bit different in that even when you're stressed, some people get fidgety, some people get really quiet. They get almost not catatonic, but they slow down, it just even physically. Difficulties with fidgeting, difficulties with remaining seated in school, or even at work, where you're not expected, you're expected to stay at working, running when inappropriate, or climbing, engaging quietly. Can a child play quietly with themselves, or do you always know where they are because there's noise coming from there? Restless, on the go, having trouble, remaining seated. I'd ask people, when you were a youngster, could you sit through an entire movie? Many people couldn't. They'd say, no, I'd have to get up a couple of times and go get popcorn or go to the bathroom. I just couldn't stay seated that long. Talking excessively, blurting out answers without any censorship. I'm going to come back to that in a minute. Waiting turn. It's simple. I would ask people, is it hard for you to stand in line? Oh God, I hate it. I just hate it. Right? Interrupting or intruding on others. In interrupting when people, not allowing people to finish their question. And I asked this one young guy, he was 25, he'd never been diagnosed. I said, do you ever interrupt people when they're asking a question? And I started to say before they've completed it. But before I could say that, he said, no, I don't do that. And I started laughing. He said, what's so funny? I said, you just did it. Oh God, we had a good time. Blurting, if you have a child with ADHD and you want to have them feel better, go online and get a board game called Blurt. It's called Blurt. And you roll the dice and then you put something, you turn over a card and it'll say like, an appendage in the middle of your face that you use for smelling. Well, the obvious answer is nose. They're not hard. My daughter, who now is incredible, she's a 911 dispatcher and the only county of 55 counties that got perfect score on their books in Minnesota, out of 55 counties. She my one other daughter went to Stanford. Two physician friends of mine and me would play, and she would circle the whole board, a blurt, and we would be back in the first quarter. We did it recently. My daughter, who graduated with a master's degree in Stanford, Maggie circled the board twice before her sister got to the finish line, because she wouldn't have a sensor. You and I censor. We check and make sure it's appropriate, or there's a no. Instant output. They'll feel good because they'll beat your butt at blurt. I'll tell you that. They've had to learn. They've had to learn to that there's times to keep your mouth shut, to wait till you have something not reactive to say. So as I said, the diagnosis requires 6 of those 9. If you're over 17, 5. Several of them, they don't have to be present prior to the age of 12. There's a whole debate right now, and we'll go into that, about adult onset ADHD. Adult onset ADHD. If you understand the principles, it makes perfect sense, right? Severe, it has to be at least 2 settings, 2 of 3 settings. It can't be in just one setting. You know, if the child doesn't have any problem with these symptoms at home, or only has them at home but doesn't have them at school or in a third setting, it has to be in at least 2 settings. And it can be explained by some other disorder. Prevalence generally is considered to be about 5% in most cultures in children, and 2.5% in adults. I'll share some research with you at the end that questions that. In preschool, a lot of times you see hyperactivity as the thing that gets people's attention. The little 2 or 3-year-old that's raising all kinds of hell in the preschool, right? And then you get to elementary school, and the problems of inattention start to become more apparent. People, especially when people have to go from one classroom to another. That's often when the inattention, the difficulty in maintaining attention comes out. In adolescence, you get the restlessness, you get the impatience, and you get the impulsivity. The impulsivity starts coming out. And when you think about why 1/3 of adoptive children have ADHD as a diagnosis, they're from unions of people acting impulsively without full consideration of the consequences. Functional consequences. If there is not a sufficient understanding, it can be very difficult with people. You get reduced academic attainment. As a result, poorer occupational performance. They're not going to make as much money in their lifetime. Interpersonal conflict, because they can oftentimes don't say things that trigger somebody else when somebody's already in an insecure state. In an effort to deal with the inner tension that comes from not understanding the output of this brain, people often turn to substance abuse disorders, alcohol, opioids. I remember a beautiful young woman, she was 23 years old, was admitted to the state hospital. She was shooting up 10 bags of heroin IV a day. She finally found something that slowed down her thinking. And I don't blame these parents, but when she was 6 years old, she was tested in the 99.5th percentile in inattention, and they begged the parents to let her start on Ritalin. And they refused because of people said, oh, you don't want to be, well, She finally found something. It was heroin that slowed down her thinking. And we'll talk about medications later. Increased incarceration because of the impulsivity. If you go to a prison, I've seen some estimates, 40 to 50% of inmates, at least male inmates, will meet criteria for attention deficit disorder. Increased traffic accidents and increased violations. Again, impulsivity, poor judgment. There's a number of studies that show the significant increase in adolescents with accident and adults with accidents and violations. Interestingly, increased obesity has become more of a problem with young people and adults with ADHD because of looking for something to like we all can do, but something to try to appease the tension. There's peer neglect. They get isolated off, and I don't know any study that I've seen on school shootings or anything, but I will tell you this, that oftentimes children with ADHD, they because of their interactions are not positive, they often get shunned aside. And if they don't find some others to bond with, they can feel pretty isolated. As they get older and have relationships and even marriages, they're oftentimes conflicted and difficult because of the reactiveness. Accidental injury. Most people that have children with ADHD will say they've made, and not all will look at it because there is heritability that's pretty high, but not all children of people with ADHD themselves or that processor will have it, but parents will tell you that the child that has had that diagnosis, they've been to the emergency room multiple times more than they have with any other child, because they're always falling out of a tree that they got too high on. They're doing this, they're doing that. They've got broken arm, broken leg, scratches, cuts, head injuries. Comorbidity, meaning, do people have difficulty with some other things too? Yeah, they have difficulty with conduct. So oftentimes children will be labeled both with, and I won't give you percentages, this is beyond the scope of this, but a considerable number will have conduct disorders, so oppositional defiant, disruptive mood dysregulation, which is a new diagnosis from a few years ago. Practically all children with ADHD diagnosis will be also diagnosed with disruptive mood dysregulation. And then you have the specific learning difficulties. Not all do, but some will have, it's not uncommon, they'll have tremendous difficulty with mathematics, or tremendous difficulty with reading, or tremendous difficulty with dyslexia, so they can again be very sensitive. Interestingly, nearly all of those things, not surprising to this group, when people get a level of peace, those things disappear. Where'd they go? Where are they hiding, right? Because in a different state of mind, they use the brain, as Elizabeth talked earlier, they use the gifts of the brain without a lot of the, and the others, the alarms are just seen as friendly alarms. Often intermittent explosive disorder. People will periodically explode. They'll get this diagnosis. They become violent. That's how many of them end up in prison. I remember one woman that was a patient of mine. She said her husband, at times they'd be going and she said, why don't we go home now? And maybe they'd have some time for intimacy. And he literally would say to her, I can't go home until I have a fight in the bar. that would be his way of relieving his tension, would be get into an argument that would go into a fist fight and be kicked out of the bar, and then he could go home. And most of us go, pardon me? Pardon me? But you have to know that he was doing the best he knew. Also, you'll see OCD, certainly about 20%, if I remember, with autism spectrum disorders also have ADHD, substance abuse, anxiety, and depression. I remember one young woman, her parents were both teachers, and I was surprised at how often this happened. That people that were teachers that had probably had more education about ADHD, but because of its being seen as something pejorative, I guess, I don't know, they couldn't see it. So this young woman had gotten a scholarship, a softball scholarship to this university, never been diagnosed. As she got into the college work, she made it through high school with just pure determination. But in college, she finally eventually lost her scholarship. They were paying for her to go. And then she gets so overwhelmed with anxiety that the 8 months before she came into the hospital after a very serious suicide attempt, she was throwing up every morning before going to school. Every morning before going to school, she was throwing up, and finally said, I can't do this anymore, and made a very serious suicide attempt. It made me think of two others, and both of them, their parents were actually professors at a university in a town I was in. And both of them had told their parents they were they had 3 months to go in their senior year of high school, and they had been counting the days since freshman year of how many days they would have to go to school before they could stop. And they were now down to less than 90 days. And they told their parents, I'm not going to college. This has been really hard for me. And God love them, because none of us are perfect. The parents, both of them, said, if you don't go to college, don't expect $1 from us. Don't expect, one of them even said, don't expect anything in the will. Both of these youngsters had suicide dates set, because the idea of continuing on, forced to go to school, death was an option better than having to do that. I'd forgotten those two. So I want to make it clear that people are suffering. They really are suffering. This young woman that I talked about that made the serious suicide attempt, that had been vomiting, she obviously never, I realized she had severe attention problems, and she didn't understand, obviously, the principles. And so I gave her a test dose of 10 milligrams of dexedrine, which we can talk about a little bit, but in a short term, ideally, then you could teach people. But so I told her to try to read something. I gave her The Enlightened Gardener, and I asked her to read for about 10 minutes. And then I asked them to give her 10 milligrams of dexedrine, and then an hour later to have her read again. The nurse told me it was traumatic, so I gave her another dose in the early afternoon. The next morning, she called her mother and said, Mom, I'm on halfway through my second novel. This is the first time I've been able to really read in my entire life. People are trying, they're doing the best they can. I'm going to give you, I put these on there's a book called Driven to Distraction. There's two people, Dr. Hollowell, I'm surprised I didn't put their names on the slide, Dr. Hollowell and Dr. Ratey, R-A-T-E-Y. Driven to Distraction, Recognizing Coping with Attention Deficit Disorder from Childhood through Adulthood. And it's a really valuable book, and yet it is without the understanding of the principles, but it certainly shows the challenges people face without this understanding. The second book is called Answers to Distraction, and it's a wonderful book because it has questions and answers. So even people with attention problems that are having trouble reading, they can read question, answer, question, answer. You know, years ago, people would come and they say, well, my daughter doesn't have ADHD because she can be on the computer for 4 hours. Guess what? There's interaction there. There's interaction. It's intermediate. And in fact, I've seen many people that graduated from high school with on a 4-point scale, straight A's being 4.0, with a 1.6, 1.7, and D plus, and get 3.9s in college. Why? Because they're really bright, and online, if they're online, they can go and study, do 20 minutes, and then later do another 20, and then later do another 20. They don't have to sit in class for a 60 or 90, or some classes even close to 2 hours. They can do it at their own pace. And so often these people get master's degrees when they barely, or doctorate degrees where they barely got out of high school. So in that book, Ratey and Hollowell list, are there advantages to ADHD processor? Here's what they say. Over thousands of young people that they've seen, men in high energy, creativity, off the charts. I think most of our inventions, ADHD and Asperger's syndrome, intuitiveness, they just know. There's times when they just know. Say, well, why? No, I don't know. But you start explaining them about universal mind and they go, oh, okay. Resourcefulness. They find ways. Tenacity. Hardworking, never say die approach. I have some people close, well, people that I know, wow, never say die. Warm-hearted, trusting, forgiving, because I think they're often really forgiving because they know what it's like to say, I'm never going to do this again, and they do it, not because they want to, but because they don't have the understanding. So I think they're forgiving of others often. Their sensitivity, they're very sensitive, often too sensitive. Their ability to take risks often can be a liability, but these people are not afraid of, quote, failure. They're not afraid to do that. They'll learn from it. They're not afraid. They're flexible. They typically have good sense of humor. I think they can laugh at themselves frequently. They're loyal. But as Ratey and Hollowell say, the negative qualities can be so toxic and so self-defeating that the strengths are wasted. So toxic, you know, and I saw so many people that once they started to understand. Now, people say, what about medications? Well, I will tell you, I've evolved in this, but I would still say that I would have no problem if I was, and I got closer to this as I was in the last year or two of my clinical psychiatry, if people came to me with severe ADHD, I'd say, listen, I'm going to give you some medicines. We're going to see if they slow things down. But my goal is for you to be able to listen to some things that I have to tell you, to listen to some videos by a man named Mr. Sid Banks, to read some books by a man named Mr. Sid Banks, and for you and I to discuss it. And we'll evaluate again at 3 months. I'm not seeing you being on this medicine for more than 6 months. And it's interesting, just like opioids and like a lot of other medications, they blame it on the medications pooping out, because over time, the ADHD medicines start to lose their effectiveness. Why? I don't think it's the medicine. I think it's because we're dampening the alarms. We're dampening the alarms that there's something important to be learned. You don't shoot out a fire alarm when there's a fire in a movie theater because it's bothering your enjoyment of the movie. And if it's a really good fire alarm and there's lots of loud music in the movie, the fire alarm will get louder and louder and louder until people realize there's a fire and they need to get the hell out of there and get the fire out. But I will tell you, I remember a young man that, and oftentimes they go into IT or data processing because they can handle, again, like they can handle large amounts of data. It's interesting because they can hyper focus. If something is really, it's not so much in it. If something is interesting to a person with ADHD, they can hyper focus and you'll have trouble getting their attention because they can hyper focus if they're truly interested. And I remember this man, he was 30, he was going to have his 30th birthday, but he had one relationship after another, jobs after another, and I started him on this medication. It's called Vyvanse, and it's safer than some of the others because if you ground Vyvanse up and you shoot it into your vein, you might as well grind up flour because it doesn't become active until it goes through your stomach. On the other hand, there's other medications that are used for ADHD that are stolen from people, or people can ground up and shoot IV, and it can be very, very dangerous, let alone addicting, but even life-threatening. It can stop their hearts. But anyway, I started him on it, and after his very first dose, he said this was the best 30th birthday that he could have ever imagined because his mind went from 400 miles an hour to 70. So without understanding people with this processor, it'd be like if you had a 16-year-old that wanted to get their driver's license and you put them in a 200 mile per hour a race car and then wondered why they crashed during their driver's test. So it takes understanding. There were two research articles that I sent that I thought were interesting. This was just from August of 2021, and various patterns of remission from ADHD in a multimodal treatment study. And it's from a national registrar. They found that 90%, typically when I was in my residency back 50 years ago, they told you that maybe 25 to 40% of people didn't grow out of their ADHD. It was considered childhood. Some, maybe 25% would have some symptoms. What they found in this study that 90% continued to experience residual symptoms into adulthood to varying degrees. Now, here's what the shocker, that up to 30% of the people in this large study had experienced during their lifetime, a full remission from their ADHD. Wait a minute. How did that happen if it's built into the brain? 30% had full remission from their ADHD. Now, 60% of those had a relapse out of their remission. Well, but here's the deal. What the conclusion was that ADHD had more fluctuating course than had been previously appreciated. The reviewer commented, the remission and relapse data will surprise some clinicians because ADHD was not generally considered to be waxing and waning like some other diagnoses. The only way it could be waxing and waning is people's state of mind, their level of consciousness. When they were in the present moment, when they maybe fell in love or they had a new, whatever, something that, or they had a job that pulled them, allowed them to disregard the output of their brain and be in the present moment, their ADHD disappeared for months, sometimes years. And then something happened in their life that they got challenged and by their insecurity or their level of understanding, and lo and behold, what comes back is their ADHD symptoms. But if they knew that that reoccurrence was a love letter, that they're taking their thinking, that they're not forgetting that their mind is different from their brain, and they're not at the mercy of the output of this computer, that would have a whole different experience. The second one was ADHD disorder and psychotropic polypharmacy, which means that more than one drug. And this was from 2006 to 2015. For the ADHD prescribing rates, people that got prescribed medicines for ADHD went from 4.8% to 8.4%, almost doubled. Stimulant prescriptions doubled, and there's another medication where people try not to use stimulants. Alpha-2 agonists increased tenfold. Polypharmacy rates doubled from 20% to 40%, meaning now 40% of people were on more than one medicine. And it was highest in patients aged 19 to 24, not in children. People are out there trying to go to college, trying to have families, trying to deal with life. And the challenges without understanding got so overwhelming. Now they're doing more medicine to try to quiet the mind. Interestingly, patients receiving counseling or psychotherapy had the highest rates of polypharmacy. Now, here's what they say. The significant increase in polypharmacy is striking, but the reasons for it are unclear. Life is puzzling if you don't understand universal principles. Better recognition, and even that they're seeing counseling. Maybe it's because there's a better recognition of psychiatric illness or something else. And the reviewer says it may be reassuring that counseling or psychotherapy is associated with more medications, which may indicate more severe illness and involvement of multiple providers. And I'm going, wow, maybe there's another reason. Maybe if the person's in psychotherapy and they're taking them into painful things of their past, they're getting more and more output from their brain, and they're getting more and more overwhelmed and having to take more and more medications. There's no judgment here. Everybody's doing the best they know how to do. But without understanding, things get pretty silly, are pretty non-productive. So I'm going to take about a 2-minute break, I will be back, and I'm fine to take questions, Elizabeth. I think the one question you had was a very good one, and I've tried to answer it already, but maybe I could do that. So I'll be right back.
Okay. Okay. Well, yeah, this is what happens when we are working with a septuagenarian. He's off he goes. Andrew, you're going to join us next week with a little bit of your own storytelling. But is there anything you'd like to share with us right now and what you've heard Bill share from your own experience?
Yeah, sure.
Just a few minutes, wow.
Yeah, I'm so fascinated when I hear him present from a medical perspective. And the first time I met him 3.5 years ago was the same thing. It was just, oh, of course. And when he went through the list of what qualifies for the ADHD diagnosis, which I never received when I was young, I got it years ago as an adult. I think there were 18 things on there and I had all 20. Like it was a wild experience as a child for me. I was always separated from the others. I was always interrupting. I was doing poorly in school, couldn't finish anything. And so it's just so mind-opening to me to hear him speak from a medical perspective about things that in rural Canada where I grew up, we just didn't have access. We didn't know. I just thought I was the one person who couldn't figure out life, and everyone else could.
I love that, Andrew, and we'll hear a lot more from you next week. You've got a lovely voice for radio there, Andrew. Just saying.
Thank you.
very calming.
He's an incredible singer. He just performed. He performed. He was the soloist at a huge Christmas program here in Phoenix, Arizona. He's traveled abroad to your country and other countries in Europe singing. So he has an incredible voice. Yeah.
Oh, well, we'll look forward to hearing more from you, Andrew. But I love what you say about the kind of reassuring nature of, this is what a brain can do. And it's not just you. And I really also like what Bill said earlier about haven't we all under a state of stress, lost attention on details, not listened, not followed through, not been organized, all the things, So I really like what you say as well, that there's such reassurance in knowing it's human. So we've got a couple of questions, and I'm going to go with the one that I sent you earlier, Bill. Just read it out to you again. It's from Sue Moore, who is on our call tonight and looking forward to it. She said that I've got an ADHD son comorbid with anxiety and depression, and he sees a psychopharmacologist. He's from my son's description, I imagine it's like living permanently in a permanent thought storm. The prescription drugs he takes do calm him, but I understand that they also can have the opposite effect on non-ADHD sufferers, i.e. they act as a stimulant. So my questions are the drugs essential to relieve the symptoms for ADHD individuals? And the follow-up question, in the recently released Sydney Banks video, The Quiet Mind, he says, we are one thought away from peace of mind. But he adds jokingly that with 100 thoughts in your head, maybe you're never going to get it. So the second follow-up question to the are drugs essential? Does this preclude ADHD individuals from finding peace of mind without drugs? Because if they've got 100 thoughts, and Sid says that makes it harder. So what would you like to say to that, Bill?
Well, it's interesting, and Andrew, in fact, there's part of me that wants to hear from him today, but maybe we'll just have you because. And yeah, we'll tease because Andrew, basically, would you say, Andrew, that this was the question you asked in our group where we were talking about peace of mind was available to everybody with sufficient understanding, and this was and he'll talk about it in a program here in Phoenix 4 years ago now, 4.5. And Andrew said, are you saying that I could have the peace of mind that you're talking about? And I said, yes, yes. Now he'll tell his story next week because it's profound, and he's one of the incredible coaches for people with anything, but especially people that have walked the road that he's walked with an ADHD processor. I remember, Sue, when I first started seeing this in my journey with understanding the principles. And I remember this, they at the beginning, they weren't the majority, but every once in a while, as books became available, videotapes became available, as I would spend time and not only doing the medication, but talking with the people about these principles, oftentimes they would come back to me, they would say, doctor, I lowered my dose of the medicine because it was getting too much. It was making me hyper instead of calming my mind. And then they'd come back and it would just, and then finally they'd come back and say, I hope you're not upset at me, but I'm not taking that ADHD medicine anymore. I don't seem to need it now. And I'd say, no, I'm not upset at you. And and they'd say, well, I sometimes they'd say, I'd like to see you a few more times to deepen my understanding. And other times they'd say, how about if I let you know if I need you? I'd say, fine. So I started seeing people as their understanding increased, their need for, sometimes it would be that they no longer needed their anxiety medicine along with their ADHD medicine, or they no longer needed their antidepressant medicine along with their ADHD medicine. And then eventually a number of people, I started saying, wow, this is really true. I mean, you'd think after seeing a man who had 47 years in a state hospital with chronic schizophrenia that said, I've been making myself crazy with my own thinking and I don't have to do it anymore. You'd think, having had that experience in 1983, that I would know that that would be possible for somebody with an ADHD processor. But I didn't. I didn't generalize it, but I started to see it. And so what I know is that if I had Sid today, he'd say, without this understanding, if you don't have this understanding, you're going to be at the mercy of the 100 thoughts from your computer. Because why? Because people get frightened by it and they fight it. They try to slow it down. And what are they using to try to slow down their speedy brain? They're using their speedy brain to try to slow down their speedy brain. Because they don't know, as I said last week, when people ask me, what do you do in the midst of a thought thunderstorm? I do the best that I can to be where I am. I do the best that I can to be where I am. I do that if I can't sleep at night. I do the best that I can to be where I am, and I usually fall asleep. If it's more than 40 minutes, maybe I'll get up and do work for a couple hours, get caught up on things, and then go back. But the idea that we can fall into the present moment, that our mind is in charge of our brain, not vice versa. Our mind is spiritual. It's our essence. It's our divine. We're little, as Sid says, we're little divine entities walking around in this form, trying to find out who we are and what we are. So I would say it's absolutely possible for anyone to come to. It's not a should. If somebody, instead of needing 60 milligrams of something, they needed 2 milligrams, or they needed it 2 days a week, but is it possible to have, you'll hear next week even more, but I can tell you, I've seen, I don't know, hundreds people now that have seen how to use the gifts that they have with their. I remember the old pictures of Bill Gates's board of directors early on, back in the 80s, and there was nobody that could sit in their chair. They were on top of it. They were over it. They were fidgeting. They were standing up. They were sitting down. They were all brilliant, brilliant people who thought out of the box. But they, at least in their professional lives, were able to use it in a way to create something that had never been created before. So that's a long-winded answer, but yes, it's possible to be at peace regardless of your processor. Can't hear you.
I'm sorry, something in your answer there really touched my heart. So, talk about in the feeling rather than the words. But what I suddenly had a sense of, and also in my own experience, is, and Andrew pointed to it. Oh, it's quite emotional. What becomes available when you stop having the idea there's something wrong with you?
Yes.
It's very moving, because so many children and young and many of us have got the idea that we compare ourselves and we can't do what someone else can do in whatever domain. And obviously in this one, I know it's a weird thing, but I really struggle with filling in forms. It's really difficult for my brain to slow down enough to fill in a form.
Fill out forms, yeah.
But that's a side issue. But when we can just be where we are, as we are, without that added story of we shouldn't be the way we are.
Right.
There's something there that is so deeply, profoundly healing. And we innocently end up with the story that we've got this label, or we're different. And I just really heard that in your answer there.
And different is okay. Different is diversity, right?
Yeah, difference, but that there's something wrong with
Not less than
that we are.
Yeah.
I really find that really moving and hopeful.
Yeah.
We have another little question here, Bill, from Nicola Bird, actually. She's asking, is there a link between boredom and ADHD? What would you say to that?
Can we free up Nicola so we can?
We can. Let's free up Nicola.
Yeah, I'm free.
Free as a bird. Free as a bird.
Yeah.
Talk to me about that, Nicola.
Well,
What connection do you see, and where's the question come from?
So I have ADHD, and okay. I was just curious about, there was something you said in, like, when our minds start to speed up, that it's, I don't know, I can't remember exactly what it was you said, but to me, it's like when my mind starts to, I just suddenly realize, oh, hang on, maybe when I get bored with projects, which I do very quickly, that's just a sign that my mind is speeding up and that my ADHD is kicking in, because I've been triggered by something that's making me insecure for whatever reason, thinking that I should be different or doing something different, or for whatever reason, insecurity arises, and then boredom comes with it. And I've been taking that boredom really seriously and changing projects, when actually what you made me kind of remember is, oh, hang on a minute, when boredom kicks in, it doesn't mean you have to do anything about it. It's just it's a love note, in the way that you say it's a love note.
Yeah.
Just letting you know that there's insecurity here, the ADHD, the busy mind's kicking in, and that's all. And that with this understanding comes, like, you'll come back home again, right? You'll calm back down again.
Yeah, that's the direction that's the direction I would say, Nicola.
Mm-hmm.
But even not so, maybe it is as specific as you said, but to me, it's just a love letter to listen, and the answers may not always be the same.
Mm.
The answer you hear when you take that as an alarm and as a love letter, the answer, I wouldn't make up that you know what the alarm is unless it's 19 in a row. It's that, I mean, I would be open to that there could be different times, different answers, but generally that it would be that you've gotten going too fast, and that a person with this processor, when that happens, they seek novelty. They get bored easily, so they need something new, something. Now, that's that same ability is what allows them to see outside the box. But I think that if you see it as the boredom as just a chance to, as an opportunity to listen, rather than to go seek something novel, something new, you know.
But that's slightly the kind of mixed message. So maybe you can help me with that. It's like, so we're wired differently, all of us, and that's really essential, and it helps us think out of the box and creatively and all that good stuff that comes with ADHD. And so that's great, but then with an understanding of the principles, then all the kind of symptomology disappears and we're calm and quiet. It's almost like if we like using the principles to eradicate the differences that we have, so we all become the same. So there's the two kind of sides to it, I guess. One which is celebrate the difference, and one is listen to, like, understand the principles, and then all of that, all of the brilliant stuff as well as the problematic stuff kind of fades away, I guess.
No, I don't see it that way at all.
Yeah, no, correct me, because I'm that's why I'm confused.
Let me see what I can do here.
Thank you.
You know, when he says each living soul experiences life as an individual, and all humans live and see in a separate reality, because we all got a different computer, right? There's no, we said this last week, there's of 8 billion people on the planet, there are no two people that have the same computer. Not even identical twins. It changes very quickly because of the use of the computer. The divine truth that lies within each living soul never changes. It is eternal. So regardless of what processor you have, when you go home to that place of infinite wisdom, then that is the level playing field. But I would say that there are some people's computers that are more set for novelty and more set for to go in directions that are outside of the, you know, we need some people whose computer is pretty just stable, so, you know, for things. But we need other people that, right? You know, Hollowell and Rady are two wonderful, they were psychiatrists, both of them at times taught at Harvard. Both of them had ADHD, significant. One of them could take medications, the other one couldn't. But they would do an evaluation for a youngster, say a 9-10-year-old boy, and I think theirs took 2 or 3 days. I mean, they really did this thorough investigation, but then they'd bring Jimmy in. Here's what they'd say to him. This is typical, something like that. Say, Jimmy, I got some good news for you. You've got an incredible brain. It can go 0 to 60 faster than practically anybody. And you're in the way high, one of the fastest from 0 to 60. And it can go places quicker and goes to places that other people don't even know exist. And it goes through this, I mean, I'm making, but this is the gist. And then he'd say, now there's a little problem with the braking system, but we're going to help you with that. It's quite manageable, and we're going to help you with. Wow. I mean, I get almost tears in my eyes when I think of what Elizabeth said earlier. What a different message that is than saying you have this, you're deficient, and the child is hearing Is this like being mentally retarded? Is this is this why they call me those names at school? To say you've got an incredible, you've got a booster, you know, and a little problem with the braking system, but we can work with that. Wow. Wow.
Bill, it's we're kind of at time, and I feel like we're kind of just at the beginning of some really rich questions. So we're going to invite everybody who's on this call listening to just send us your questions, and we're going to have a panel next week. I may appear on this panel as well to just share what I've seen about the impact this understanding can have on really my relationship with my own brain. So that's, and then we'll hear a lot more from Andrew, and Bill will talk more. And I think Chrissy is going to come and join us as well. She's somebody else who's diagnosed quite young and through lots of challenging circumstances. So we're going to hear lots more stories, and the whole session will be devoted to stories and questions. So please keep them coming. And if we haven't got to you today, it's because we're just teasing a little bit tonight. But I really think we just draw a line there, Bill. I think really that last piece was just so reassuring. I think we're not trying to change ourselves. We're trying to understand our brains and understand who we are before that. And that's really where we're headed, aren't we? With this whole understanding and the teaching that we offer.
It really is, you know, and that's what the last course and this course, using the Enlightened Gardener and the Enlightened Gardener Revisited, are towards helping people facilitate and recognize the understanding that's already within them. All we have to do is get out of the way of it. We don't have to put anything in. We just have to get out of the way of the impediments. Yeah.
It's beautiful. Well, we know this is part 1 or part 3 of a 4-part series. We'll see you next week. Same bat time, same bat channel. It's Tuesday, the 11th of January, 7 to 8:15 p.m. UK time. And we'll be looking forward to hearing from you. We'll remind you, you can send us your questions and we'll send you the recording. Lovely to have you on the call tonight, everyone. And you too, Andrew and Bill, who we'll see next week. Good night, everyone.
Bye-bye.